Throughout the semester, we have learned a great amount about the elderly and life as we age. Today, the nation's elders are defined as anyone that is 65 years or older. It is important as future healthcare professionals to recognize the growing elderly population. This increase is mainly due to the enhanced knowledge of healthcare and the spike of the baby boomer generation. I was surprised to learn that the baby boomers are the most educated cohort in history. I believe this is important for future healthcare professionals to recognize because there may be a vast spectrum of knowledge between different patients. When learning about the feelings of elders, I was surprised to see that most saw themselves as young or middle-aged. This differs from my own personal experiences because a majority of the elderly individuals in my life suffer from many chronic illnesses and live each day in a great deal of pain. Here's a picture of me and my 83-year-old grandma, and even though she has scoliosis, has had 2 knee replacements, and has broken her femur, there are few things that get in her way of living her life. With the help of family and friends, she is able to make sure each day is one worth living. Recognizing the physical and mental differences between individuals is an important aspect when trying to have successful patient interactions. In order to prevent certain chronic illnesses, the elderly can partake in regular physical activity, maintain a healthy diet, and keep their minds sharp through social interaction and lifelong learning. A few health benefits of physical activity include improved insulin sensitivity, an increase in good cholesterol, a reduced risk of cardiovascular disease, strengthened bones and muscles, maintained cognitive function, and improved balance, reducing the risk of falls. As a future healthcare professional, I will promote healthy lifestyles in order to improve the lives of my patients. On the other hand, some physical and mental changes are unable to be avoided. As we age, it is most likely that we will have some sort of hearing loss, worsened vision, diminished taste and smell, impaired balance, a decrease in blood circulation, hair loss, increasingly thinning skin, decreased bone density and muscle mass, a decline in immune function, and increased fatigue. It is important to recognize these changes in the elderly in order to help them adjust to their new sense of normal. With decreased health comes increased medical expenses. The elderly must have some source of income and financial assistance in order to survive. Social Security is a guaranteed monthly income to individuals 65 years and older who have paid into the program during their working years. As the baby boomer generation starts to retire, adjustments will have to be made in order to support retiring individuals. Medicare provides selected medical benefits for the elderly and is divided into 4 different parts, and the individual must fit certain requirements in order to receive benefits from each part. Medicaid is available as protection against high costs of extended hospital and nursing home care and physician care. Understanding the details for each aspect in medical care is necessary when working as a future healthcare professional. When it comes to racial and ethnic diversity, healthcare professionals must adjust to the way in which they interact with the elders. Many individuals may have different historical backgrounds and beliefs about health, illness, and formal care. It is the initiative of the healthcare providers to do their best to learn these things in order to successfully treat their patients and family members with honesty, compassion, and respect. Dementia is a progressive brain impairment that interferes with memory and overall cognitive function. If left untreated, the resulting consequences may include physical impairment and even death. The most common cause of dementia is Alzheimer's disease, which is typically diagnosed after the age of 75. This disorder may become frustrating or upsetting for certain individuals because the patient may not be able to recall past events or even remember who family members and doctors are. Therefore, this disorder and many others may leave patients with a loss of family and friend interaction. For many, it is extremely hard to see their loved one as a completely different person. That is why it is so important for healthcare professionals to accommodate the needs of dementia patients and be as patient as possible. The issue of death and dying is extremely hard for many people to handle. As an individual who wants to work with the elderly, it will be something that I am faced with often. Each person may handle the death of a loved one differently, and coming to a consensus of understanding is most important to avoid conflict between family members and others who may be affected. As discussed in class, there is a large debate as to whether or not physician-assisted suicide should be legal or not. Many say that if one is terminally ill and living a miserable life, that they should have the choice to end their own life. This may bring about many legal and moral issues. I believe that if the law is passed in Wisconsin, that there should be many regulations in order to make sure that the system is used properly and for the initial purpose. Lastly, I have learned that as I continue my education and start my future career, I may have to partake in activities that I do not fully understand. By having an open mind and being patient, I believe I can overcome these particular obstacles and still prove to be successful as a student and a future healthcare professional.